Welcome to the RD Squeeze. I'm Micki.
And I'm Emily.
And we're two dietitian besties here to squeeze out the misinformation around health and nutrition. Hello, everybody. Welcome to the RD Squeeze. We have another amazing episode, an amazing guest with us today. So it's a kind of a more serious topic, but hopefully with a very positive ending. So our episode is a heartbreaking reality, an RD's experience with spontaneous coronary artery dissection. And if you've never heard of that, neither have I up until we are talking with our guest today. So very excited to have Dr. Andrea Barnes on our podcast today. And just as like a little personal quip before we get into Andrea's full bio, because she's a very impressive individual.
Yes, she is.
Andrea and I go way, way back. Andrea is one of the reasons why I'm a dietitian today. And she was a past preceptor and really helped me through clinical, which is what I struggled with when I first started. So I owe a lot to Andrea. And then I also kind of followed in her footsteps for PAN's presidency and just all kinds of stuff. But she's got tons of stuff. But Emily, I know you are going to get into her bio. And yeah, I'm just so excited to have you.
So welcome, Andrea. Yay! Thanks for joining us. So let's get through your very impressive background here. So I'm going to read through it because I'm not skipping a beat here. So Dr. Andrea Barnes is a registered dietitian, RD, again, if you forgot what that means, researcher and health policy advocate with a career dedicated to advancing integrated healthcare, nutrition security, and patient-centered care. She is a fellow of the Academy of Nutrition and Dietetics and serves as the state policy representative for the Pennsylvania Academy of Nutrition and Dietetics. Andrea recently completed her Doctor of Behavioral Health degree, focusing her research on global health workforce development and quality improvement in nutrition care access and integrated behavioral health care. And we're going to get more into that too. In addition to her academic and policy work, Andrea serves as an editorial fellow for Family, Systems, and Health, a peer-reviewed journal of the American Psychological Association, and an advisory board member for the Bangladesh Institute of Innovation and Research in Dhaka. She also teaches foundations of children's behavioral health at the Urban College of Boston. Beyond her professional accomplishments, which is, again, continuing on, Andrea shares her personal story today of experiencing SCAD, which Micki mentioned, to raise awareness of this under-recognized condition. By blending her expertise in healthcare with her lived experience as a patient, she advocates for more inclusive, compassionate, and informed care for individuals facing complex health challenges. And Andrea, I know you've done much more than your bio has listed. So again, you have done so much. I've met you through the Pennsylvania Academy. So again, many connections here on this podcast to PAN. But it is so great to have you. And thank you so much for ahead of time sharing your personal story here.
Thank you so much for having me. I told Emily earlier that I was really nervous to be on the podcast. And so I've done news segments, like cooking segments on the news. I've given presentations. I've even been a keynote speaker, but this is the first time I'm talking about my own health, so it's somewhat terrifying.
Isn't it always harder to share your personal story than just your expertise? You're like, oh, I can hide behind the expertise,
yeah.
but you know, we appreciate you being willing to share this because we reached out to you for a completely different, topic. We were like, hey, we just want you as a guest because you're just so impressive. And you offered this topic to us and, we're excited to get into it for sure.
Thank you. I want to point out, I don't know if you guys pointed this out on previous podcasts, because I know you talk about PAN and credentials and things like that. A fellow of the Academy of Nutrition and Dietetics. And that's really about recognition from peers. Micki, you're a fellow, right?
Yep. Mm-hmm.
So that says we've made this lasting contribution to the field, and whether that's through research, education, mentoring, or advocacy. And for me, it's both an honor and a reminder of the responsibility that we have to keep advancing this profession. So
I love that.
I started my journey with a Bachelor of Science in Nutrition Science from Cedar Crest College, where I also concentrated in gender studies. I completed my dietetic internship through the University of Delaware, and then I went on to earn a Master of Science in Clinical Nutrition from the New York Institute of Technology. And most recently, as you mentioned, Emily, I completed my doctorate in behavioral health through Arizona State University with a big focus on that integrated behavioral health care. And that program actually required an internship too. So I interned with a university for business education and research in India, which was what really kind of first exposed me to global health. And was amazing. Now I'm getting a graduate certificate in population health at the Jefferson College of Population Health. And I just watched like a couple of episodes with your former guests, like Tori Keebler and Emily Borgo. And this seems to be a common theme with RDs. Like we just love to learn. Like I'm a forever student.
1000%. I mean, when I got my master's, I was like, oh, you can pay me to go back to school. And here I am back in school. And I'm like, what am I doing? Like,
Yeah.
But it is so true. Like, even like the books that we read, like, it doesn't necessarily have to be like an advanced degree. It's just like the continuing education piece or like the books or, journal articles. We're always constantly researching. I think that's one of the reasons why Emily and I also kind of started this podcast is because we wanted to share our knowledge but also learn more, and this was a good way to start those conversations and learn more. And I'm learning so much through this podcast. It helps keep me on my toes for sure. I don't know if Emily you feel the same way, but
Definitely.
I just have that constant need to learn.
Mm-hmm. Well, after working over a decade in clinical nutrition, both in skilled care and outpatient care, I chose the path of behavioral health because I saw how much mental health, stress, and social determinants affect nutrition and overall health outcomes. And over time, that grew into a passion for global health because the challenges I saw in my own community were reflected times 10 in communities around the world, especially when it comes to food insecurity and health equity and just access to quality care. And for several years, I ran a private integrated care practice helping individuals with disordered eating. But after my SCAD event, which we're going to talk about today, I had to step back from that clinical work to focus on my health. But it also opened doors for me to make an impact in new ways. Now I teach as an adjunct professor. I serve, PAND, and I work on global research projects to strengthen the healthcare workforce, which means training individuals from all over the world to integrate behavioral health and nutrition into primary care settings and clinics. So today I'm bringing to you the perspective of a clinician, a researcher, an advocate, and now a patient. And I think that combination really shapes the way I see recovery and resilience and the importance of person-centered care.
Oh, that's amazing. I think that's so important just as we move forward in our healthcare system and what we're doing. What does like the research kind of look like? I mean, you kind of just mentioned it a little bit, but like how do you get involved in that besides being adjunct professor and having your background in the doctorate?
Well, anybody can do research, right? You can start in research just by doing reviews, right? Systematic reviews or scoping reviews of other research, like if there's a topic that you're interested in. But my opportunities really expanded when I was getting my doctorate because I had some great professors who were doing a lot of work in Southeast Asia, for example. And so I got the chance to work with them. And that, really expanded my network. And now I'm just meeting people like through LinkedIn who live in Guatemala and Bangladesh. And, whenever there's a topic that we're interested in learning more about, we get together and we come up with a question. That's how most research starts. And then start looking through literature, and if you're lucky enough to get funding for research, then you can do like pilot studies and you know original research. But a lot of times it's just reviewing literature out there, and how you can just bring awareness to a topic.
Yeah, that's so great. And we need more of that. We've talked about this on previous episodes, but like nutrition is such a complex research project that if you're doing like pilot studies and things like that, it's going to take a long time. It's not just like a 6-month thing. I mean, you can collect data, of course, but is it going to be meaningful and able to be extrapolated to a population that you're looking at?
Right. Absolutely.
Yeah, so I have a follow-up question, but it's kind of taking us back to the beginning because I feel like all dietitians kind of have a similar start in a way, but I'm curious, Andrea, what made you choose dietetics, in Cedar Crest College, and like how did that, I don't know. You've had worn many hats and like manipulated your career into so many different areas. So like why dietetics in the first place?
Um, this could be a really long drawn out story, but I'll give you the brief version. So when I originally like graduated from high school, I didn't know what I wanted to do, right? So I dabbled in. I always loved science. My dad taught me to love science. So I dabbled in biology. I didn't necessarily want to be a teacher back then because I didn't think beyond like the school that I had already gone through, grade school. um, so then I thought, um, maybe I want to do nursing because I really enjoyed, medical stuff. And again, I just love learning. So I actually went to Cedar Crest College as a nursing student, and at the time, I don't know if people are still experiencing this, but like the internships, like the clinical rotations, there was a wait list to even start. So there was going to be like a year where I was just sitting and doing nothing, just waiting for clinical rotations to start. So I was like, what else can I do in the meantime? Like, I can't just sit here. So, talking with my advisors and things like that, I learned about their nutrition program, and I was like, oh, this would be a great, like, follow up, to the nursing program, and, give me some more experience and be well rounded. And once I started in that program, like, I really enjoyed it. And so I just dropped the nursing and stayed in nutrition. But again, like, as much as I love the nutrition field, I'm just continuing to learn. And so, as I learn more about how nutrition affects other things and how other things affect nutrition, I want to expand in my education. So, I moved into behavioral health, and I'm trying to combine pretty much everything I've ever learned, into my own little package.
Oh yeah, I mean, like I said, you've evolved in so many different, career paths and like different areas of interest. And I think, it's I've always like respected that you've made things to like morph into your interests. And I just
Mhm.
always appreciated, I remember like when you were kind of mentoring me as pan president and I was president elect, like, the way you worded things and the way you described things, what you were passionate about and what was giving you like that fire at the time was panned. And like just to see how much it's morphed into so many different things. And I knew at the time you were, just pursuing your doctorate, and now you finished it. And it's very cool to see how you've progressed and evolved into like this, I don't know, amazing dietitian that is just like so well rounded and so great, and
Thank
just one of
you.
probably the best mentors
Aw.
that I've had. But anyway, we have you on for a more personal story too, as well. So, do you want to get into the main squeeze of it and get into your personal journey?
Yeah, so funny you named this segment main squeeze because my left ventricle doesn't quite squeeze at full strength. So my main squeeze is like less fresh pressed juice and more watered down lemonade. So
That's funny. That's funny, but
Not
like,
laughing at you, laughing with you.
yeah, that's a funny joke and a funny way to think about it, and probably only a dietitian joke, right?
yeah, but you have to laugh, in these situations because, well, we all know laughter is the best medicine. But, if you don't kind of bring humor into it and make light of it a little, like, you'll just be depressed. So,
Right. Yeah. So, with that, I'm going to give just kind of a brief introduction of like the
Mhm.
clinical aspect of SCAD. So, that is again spontaneous coronary artery dissection. And this is
Mhm.
a condition that is an emergency condition. So, it's, not to be taken lightly. And it actually occurs when a tear forms in a wall of a heart artery. And this can obviously slow or block blood flow to the heart and causes potentially heart attack, heart rhythm problems, or even death. So, luckily, you are still with us, Andrea. Um, and this most commonly affects women in their 40s and 50s, but it can occur in men. And
Mhm.
there's not always specific risk factors for heart disease with people with SCAD. So you don't always see high blood pressure, high cholesterol, diabetes, things like that. um so yeah, so Andrea, can you tell us more about this specific diagnosis?
Yeah, yeah. And definitely thankful, grateful to be here, not just on the podcast, but in life. Um, while the medical definition kind of really focuses on the tear in the artery wall and the dangers it creates, I think the patient experience really tells a deeper story. So SCAD often comes out of nowhere, right? It strikes people who appear healthy, they're active, and without traditional risk factors for heart disease, like you said. Um, for many, there's no warning at all. One moment you might be exercising, you're managing daily life, or even resting, as in my case, and the next you're in the middle of a sudden heart attack. Um, and so, what makes SCAD especially frightening is how unexpected it is. Many patients, like you said, are younger women, often even in their 30s to 50s. And they're often told, like, you're too healthy or you're too young for heart problems because it doesn't fit that typical profile for heart disease. SCAD is sometimes misdiagnosed at first. Um, and that delay can increase the fear and uncertainty patients feel when their bodies are signaling something is seriously wrong here.
Want to bring up, like you just said, it's not something that might be misdiagnosed. And so because this is kind of in our women's topic season, I want to bring up too, like, a lot of women's conditions are underlooked because they just think we're complaining. And again, you said, some of these are just happens. There's no really warning signs for it. So even more reason of just looking at what some of the symptoms could be, which we're going to get into, but also like why women's health is so important. We don't know maybe a lot about SCAD as far as, are there other conditions that can be looked at that correlate to it? Or do we know that? Do we know that, Andrea?
Yeah, we're gonna definitely get into that, and I want to just touch on the point, where you said about women, and that we're complaining. I think it goes more towards the fact that women, back so many years were meant to take care of the family, right? So um, they don't advocate for themselves. And so I think that that is, maybe something that we're seeing in, younger generations. Um, but, women don't think to take care of themselves first, right? They're always taking care of other people. So, you might feel something and, you know, do you have time to rest? I don't know, but you need to. Um, so do you want me to kind of go into my story now?
Yeah, I mean, I think that that would be great because I think, we're talking about more of the clinical aspects, but I mean, we want to hear and share your story. So yeah, share your experiences.
Yeah, so I'll take it back a few years because a few years ago I had a complete hysterectomy because of a gene mutation that put me at a high risk for ovarian cancer. Ovarian cancer was in my family. And that's probably a whole different podcast episode in itself. But I mention it because the hormone changes that followed may have been part of the bigger picture. You'll see that a lot of women are experiencing SCAD like while they're giving birth. So it could be, the stress of childbirth. It could also be the change in hormones around that time. So this is something that, cardiologists are still learning about. But, hormones or change in hormones may, play a part. And at the time, life was heavy. I was working on my doctorate, I was running a business, and I was grieving the sudden loss of my father. So stress was definitely a factor. And the month before my SCAD event, I caught what seemed like a simple cold while traveling to a conference in Minneapolis. Maybe you were both there. But that cold lingered for weeks. I don't know if you've ever had a cold that just like does not go away, but this cold was like literally a month long. Um, and so I was prescribed steroids, cough medicine, like the usual treatments. But instead of improving, I actually grew so fatigued that I could barely stay awake during the day. And so, that wasn't me. And at one point, after an adverse reaction to prednisone, the steroid that was prescribed, I ended up in the ER. Um, Go forward like a little over a week later, and while still recovering, I felt what I thought was the worst heartburn of my life. Now I've had two children, and so I've had heartburn. But this pain radiated like into my jaw, out into my shoulders. Now, as a clinician, I know the signs and symptoms of a heart attack in women, but it never crossed my mind that this could be happening to me. At no point did I think I was having a heart attack because I had no history of heart problems. My calcium score was 0 just months before. No plaque in my arteries, no warning signs. So at the time, I did a virtual urgent care visit, and they told me to take omeprazole, with proton pump inhibitor. Yeah. Later that night, I got up to use the bathroom, and I quite literally dropped dead. And that's not a phrase most people get to say out loud and still be here to tell the story. So my children heard the thud from down the hall. My husband rushed in, performed CPR, called 911. My heart was stopped for about 15 minutes before EMTs revived me. I spent 3 days in a coma and 10 days in the hospital overall. Test revealed the culprit was a spontaneous coronary artery dissection, so SCAD. In my case, the tear was tiny. It was in a distal branch of a distal artery on the left side of my heart. And so what happens is like the artery wall, as it dissects, it separates. And so it like folded inward. And so it blocked the blood flow. And so that's what actually triggered the heart attack. But because my heart was already weakened, likely from that virus, the outcome was catastrophic. I had a cardiac arrest. Um, so, and that virus, possibly adenovirus, so like the virus that causes common cold, like how many times have you had a cold, right? Like it could be any number of viruses at this point, right? But like to think that that could cause damage, like that much damage to your heart, and then to have the SCAD on top of it. So the damage that I had left me with reduced heart function. So my ejection fraction, basically how well the ventricle is squeezing, has been between 25 and 37%. So for context, normal is 50 to 70. So the left side of my heart doesn't squeeze the way that it should. And that's why cardiac rehab has been so critical, not just rebuilding my strength, but helping me really trust my body again. Um, SCAD isn't just a heart condition, it's like a life altering event that reshapes your body, your relationships, and your sense of safety. So today I share this story not just to talk about SCAD as a medical condition, but to really humanize it, right? Like you can learn about the medical part of SCAD online. Although it's not um it's not as rare as it used to be. Because I think, we're building awareness on it. But it is not common. Um And because heart disease doesn't always look like the stereotypes we imagine, prevention isn't perfect, and healing takes both body and mind. And if there's one thing that I really want listeners to take away, it's this like, know the symptoms, but never ignore what your body is trying to tell you.
So there's a couple points I want to kind of talk about, but you did lead very well into the signs and symptoms.
Mm-hmm.
So I would like to cover like the specific signs and symptoms, like you mentioned what you had, but maybe talk about what other signs and symptoms that people can look for in this case. The other thing I wanted to kind of circle back to, and we can go in whichever order you'd like, was the fact that you said like we don't typically think of um, people with heart disease as someone who looks a certain way or acts a certain way or is physically fit versus not physically fit or
Mm-hmm.
whatever the case may be. So I don't know if you wanted to talk a little bit more about that, because you mentioned earlier like the determinants of health and what that looks like. And we've kind of touched on that a little bit on the podcast as well, so listeners might be familiar with that, but if you want to touch on that a little bit, and then the other thing I can get to later.
Okay. So you want to talk about the signs and symptoms first, and then we'll
Yeah, sure.
go into your other questions?
Yeah. So I mean, for the research that I did for Emily and I for this, was, the signs and symptoms that, will be present on Google is chest pain or pressure, pain in the arm, shoulders, back, or jaw, which you mentioned, shortness of breath, unusual sweating, extreme tiredness, upset stomach, a rapid heartbeat or fluttery feeling in the chest, and feeling dizzy. And you did mention a few of these. So
Mm-hmm.
do you want to talk a little bit more about that?
Yeah. So the symptoms: chest pain, shortness of breath, pain radiating into the arm or jaw, dizziness, nausea, like those can all be overwhelming on their own. And most of those are the heart attack symptoms. Like the SCAD itself, there's like no symptoms. It's so if your artery wall separated and it didn't block the flow of blood, I don't know if you'd even know that this happened, you know? And I don't know if, I'm not a cardiologist, but I don't know if they know either. Um,
So sorry, can I butt in? So how do you know then if you have SCAD if you don't even know what's happening? Is it only if people end up having this kind of cardiac arrest and it blocks the pathway?
so most people don't have the cardiac arrest part of it.
Okay.
That was because I had heart damage from what we think was the virus. Um, Most people who have SCAD have a heart attack, or um, mm, as I mentioned before, many women experience SCAD during childbirth. So like their blood pressure like plummets, and they're already being monitored, right? Because they're having a baby. So so they can pick it up because of, what they're monitoring. But I don't know that they even know that this is what is happening at the time, they might see these, numbers changing. The monitors are probably going off. But it's not until later when they do testing and actually, scan the heart that they can see that this artery has, separated. Um, and beyond the physical symptoms, there's this emotional impact, right? So survivors often describe a deep sense of vulnerability, like the shock of realizing that their heart, like this very organ that you trust to sustain you, has suddenly just turned fragile, right? Um, so yeah, there's the physical side of it, but there's also the emotional side of it. And I can only share what I know because I've experienced it. Um, you know, if you think that you might be having some kind of symptoms that are unexplained, you know, keep going for more tests. I remember, several years ago, I was having tingling and numbness in my feet and hands. And so, because I am a clinician, like I know to advocate for myself. Most people who are not in a clinical role or in some sort of allied health field don't think to always, like we said, go with their gut and pay attention to what their body's telling them. So, I kind of pressured my primary care physician to say like, "Hey, this is not normal." And I'm going to ask you if we can just keep doing as many tests as possible until we find something. And we didn't find anything. I mean, I was tested for MS and all kinds of like autoimmune disorders. Um, and we chalked it up to my anxiety. That's why I was having tingling and numbness. And anxiety can cause chest pain, right? So, if they don't see overwhelming symptoms that point to, heart attack, this could go misdiagnosed for a long time.
Would it be, and maybe you could paint a better picture than I can, but would it be a fair assessment to say, like, you could have, like you said, a heart attack or something leading up to this, but really once that artery separates, that is the point of like that SCAD. It's not necessarily everything leading up to it. It's more so just like the dissection, which then obviously causes you to, like you put it, drop dead. So that's like, it's like basically I'm thinking if like your hamstring popped, and this is the lighter version of it, like your hamstring popped and it deteriorated, like it ripped off, like then you couldn't walk. So it's like kind
Mhm.
of, that's like how I'm trying to like rationalize it in my brain. Like there's really nothing leading up to it. It's really like this, there's so many factors that can contribute, but the actual, event is this piece. Does that make sense?
Yeah, it does. But so mine is a little unique.
Mhm.
So when most people are having a SCAD, um, like I said, the wall of the artery will collapse. And as it's collapsing, like it may slowly collapse over time. It just doesn't flop necessarily. So like you're slowly closing off the blood flow, right? And so mine was very small. Um and so imagine that someone has it in a major artery. Like I know people who have had SCAD in, one of their main arteries in the neck. Um, so that's going to be like a much bigger impact than what I had as far as the heart attack part. The reason that I also had the cardiac arrest was because, and I didn't know this, that my heart was apparently weakened by this cold virus. And so it already like wasn't squeezing well. And so coupled with the heart attack and the cutoff of the blood flow, that is what caused me to have the cardiac arrest. Because when I stood up, my blood pressure just completely dropped. So have you heard of postural orthostatic tachycardial syndrome? So I had that years ago when I was in my early 20s. And basically that means that when you're changing positions, going from a sitting to a standing position, your blood pressure drops and your heart rate goes up. Um, Many people have this. I've learned that many women have this in their 20s and they grow out of it. And so when the blood flow was cut off because of the SCAD, and then on top of my heart being damaged, when I stood up, basically my heart just stopped beating. But that doesn't normally happen in a SCAD, right? So most people will just have the heart attack. And of course, if the heart attack goes untreated, then, people can die from it. But I dropped dead.
So are there other risk factors then for potentially getting SCAD? Like you mentioned women, so that seems to potentially be a risk factor then. Are there any other ones?
Yeah, so being female, extreme stress, and childbirth, because childbirth is both stressful and there's a change in hormones. Very high blood pressure. And actually my blood pressure has always run low. So again, not a risk factor that I had. Drug use. You'll see SCAD in patients that are drug addicts or abuse drugs. And something called fibromuscular dysplasia, which is a connective tissue disorder. It's where the arteries are weakened, which I also don't have. I've been tested for that as well. And so when we're talking about risk factors for SCAD, yes, these are the most recognized ones, but these factors can all put stress on the artery walls, making them more vulnerable to tearing. And when we're learning more about this condition, we're learning now that it's possible that there's a connection between SCAD and some other diseases, not just fibromuscular dysplasia. Many patients who experience SCAD also have a history of inflammatory disease like sarcoidosis. Sarcoidosis doesn't always just affect the lungs. Most people associate it with the lungs. You can have it centralized to the heart as well, or other organs, or sarcoidosis is where the immune system is overactive. But you can also find connections in research with autoimmune conditions like lupus, rheumatoid arthritis, Hashimoto's thyroiditis, antiphospholipid syndrome, even inflammatory bowel disease. I know you've talked about that on the podcast.
Wow, that's really interesting, some of those. Yeah,
yeah.
Okay, let's be
so
aware.
autoimmune disorders cause chronic inflammation, right? So, and that can affect the strength and the flexibility of blood vessels over time. And so that ongoing inflammation may increase. I'm not saying that there's a 100% association, but it may increase the susceptibility to a tear, even if someone doesn't have the classic heart disease risks, like you mentioned before, high cholesterol or diabetes. So this connection is still being studied. It's an important part of the patient's story, though. And for many people with autoimmune conditions, SCAD is a reminder that systemic inflammation, as we know it, isn't just about joints or digestion or hormones, right? It can also affect the heart and blood vessels. And when you combine that underlying inflammation with another stressor, such as we talked about childbirth, intense exercise like deadlifting, where you're straining, or you're having that sort of like Valsalva um, response, or even just like emotional upheaval, that risk of SCAD may become more real.
Wow. I'm thinking of a research project here for someone. Feel free to take it, anyone. But just looking at C-reactive protein levels, so inflammatory response in people with SCAD. I wonder if there's a certain level that they get to that's kind of unremarkable, or is there an in-between level? So yeah, anyone, feel free to take that. Go ahead.
Yeah. So I was tested for every like autoimmune disorder that I think my doctors could think of. I was even tested for HIV, which is scary to think about. And talking to your partners about that, right? But thankfully, like none of that was an issue in my case. So I literally have no uh risk factors except for this cold that I had, which makes my case so unique. Because, like I said, we have colds all the time. You're not thinking that it's going to affect the heart. So I think that's why this particular heart issue highlights the importance of looking at health holistically. It reminds us that care isn't just about test results or risk factors. It's about the whole person sitting in front of you. Clinicians need to take symptoms like chest pain, heartburn, tingling, and numbness seriously, even when the patient doesn't fit that typical heart disease mold, right?
Well,
Look at these people that are doing like CrossFit and things like that. Like they're strong, they're healthy, um, but those styles of working out can actually put you at risk. And so we don't think about the healthy behaviors that we're doing putting us at risk for something like this, you know?
well, that's kind of, I guess that's maybe why it led to my question before about like, people don't necessarily look like they're going to be sick, or they don't necessarily look like they're going to have this issue. And I mean, what stuck out to me for you was like that heartburn, and you had that telehealth visit, and you might have said, I think it's just a really bad heartburn. Now, I don't know if you actually said that, but like we tend to do that. We'd be like, oh, I think it's this. So then the doctor's like, okay, yeah, it is. And they're going to prescribe, omeprazole, or they're going to, say take a Pepcid and call it a night. And like, we tend to like almost also diminish it. But then I think some healthcare providers, they don't take that extra step because they're like, oh, they think they know what it is. So, just to say like maybe it might be better to go in and say like I really don't know what's going on, and even though it sounds like this, I don't know. Or and maybe that's something you can leave with our listeners, is like how to advocate, like what do people say to clinicians when they do feel like something's wrong, or to push further.
Yeah, well, I think not diminishing what you're feeling is first, right? Like tell them exactly what you're feeling. And as a clinician, I said, like, I'm having heartburn. I feel like it's, coming up into my jaw. I can feel it in my shoulder blades. And that still wasn't enough for them to think, you're having a heart attack, because they have my history in front of them. I've been a patient at that health system forever, and no, no heart issues whatsoever.
Wow, even as not a medical doctor, I would be like, that's pretty alarming. That sounds pretty serious.
Yeah. And I don't like to bring this up, but my father passed away a few months before all this happened to me. And he was a veteran. And Emily, I know that you work at the VA. He went to the VA for care. And, other than some high cholesterol, he never had a, a clinician look further into his heart, right? And when he went into the hospital because he was having a stroke, they finally looked at his heart and said, oh, like all 3 of your major arteries are 100% clogged. How did he have no symptoms before having a stroke, right? So this is why, I advocate for patient-centered care, right? Like looking at the patient as a whole, not just the symptoms that they're coming in with at the time. Look back, like what are the other risk factors? And this is another reason why I think behavioral health is so important because, you may have a patient come in for, cholesterol, and they may hand you a piece of paper that says, okay, like avoid these foods, right? Um, and, come back and see me in, 6 months. And if you're not better, if your cholesterol hasn't come down, then we'll like put you on medication. Well, nobody takes into account what's going on in that patient's life, right? Like that patient has a new baby at home. They're not sleeping, right? They're working 3 jobs, so it's not just what they're eating that is affecting their blood pressure, or their cholesterol. Maybe they have a family history, and they didn't know because they aren't aware of your family's medical history. So you really need to take everything into account. And as the patient, you need to be upfront with your primary care physician about, all of your history. And if they don't have time to listen, that's why we need to integrate behavioral health into primary care, because then they can say, you know, as a physician, I don't have the time because I have so many patients I have to see, but I'm going to have my, behavioral health consultant come in and chat with you, to get some more information, and then we can work out a plan. Because it's not just the physical health, it's our health behaviors too.
100%.
Yeah, I think
Yeah.
that's a good point. And I want to kind of circle back just to, obviously treatment, you had surgery. So is that the typical treatment for SCAD? And then like, what's the prognosis? And then also in your case, what changes have you had to make in your life, like from, before your diagnosis to after, and what might that look like for somebody else if they're going through this?
Yeah. So in terms of treatment, depending on the size of the tear and which artery is involved, surgery to repair the artery isn't always required. So in my case, I didn't have surgery to repair the artery itself. Medication and time have been the approach. But as I've been saying, like recovery just isn't about the artery healing. It's about rebuilding trust in your body, managing fatigue, and living with this like uncertainty of recurrence. And so my doctors were quick to insert a device, which is the surgery you're talking about, Micki, which is a pacemaker and a defibrillator in one. So I have a little bit more insurance. I belong to a couple of like Facebook support groups for women with SCAD, and not all of them have had devices put in. So, if they're having another recurrence, and their heart rate is, decreasing, they don't have that extra insurance that like the pacemaker is going to help. Or if if their heart does stop, if they're having a heart attack or they're having cardiac arrest, that the defibrillator is going to be there to shock them back. So I do have a little bit more insurance. Cardiac rehab has been a cornerstone of my recovery. And it's not just exercise under supervision. It's really helped me not just retrain my body, but rebuild confidence in myself, better understand my limitations, and learn how to move forward safely. Um, Surviving something so sudden changes the way that you see your body and your sense of security. So many survivors, myself included, they deal with anxiety, depression, even post-traumatic stress. So for me, behavioral health is and mental health care and support has been just as essential to my medical care. Um, I think in terms of treatment and recovery, I think SCAD also affects the entire family. My children remember that night vividly, and my husband, who performed CPR and essentially saved my life before the EMTs were able to come, that he still carries that weight. And so supporting their emotional health has also been just as important as tending to my own. Many people find comfort in connecting with others who live through SCAD. So, like I said, support groups, um, because it is a life altering experience. It reshapes your identity. It totally reshaped my goals. I had to give up a practice because I had to think about, the stress, of running a business. And even though my artery has healed, I still have damage to my heart. So that's, a unique thing. I still have random chest pains. I still have chest pressure. I know that other women who've had SCAD, um, like depending on how severe it was, they still have random, pains and pressure. I have episodes of fluid retention because my heart isn't pumping at its best. So I might have shortness of breath. So I have to listen to my body. I have to make decisions about whether or not a random chest pain is an emergency or, it's just going to come and go and I don't have to worry about it. I have to check my blood pressure twice a day. A few weeks ago, I was actually feeling dizzy when I stood up. So, brings back memories of POTS. Um, and I had to make the decision to monitor my blood pressure sitting, standing, and lying down. And I only made that decision because I'm a clinician and I know. So, people that are not in this field or, any health field, again, they don't have that sort of information. So, checking your blood pressure. I actually found my blood pressure was plummeting when I stood up to 67 over 44. So I went to the emergency room for IV fluids to bring up my BP and found out that I really just needed an adjustment in my medications. So I went from having one medication that I took every night to now 10 to 12 medications. And so the combination of the meds at the doses that I was prescribed was fine for a while, but it ultimately dehydrated me because I was on, diuretics. It dehydrated me too much. And so my kidneys weren't happy and then they started not to function properly. So this, it reminds us to listen to our bodies, get help quickly when something feels wrong. And again, recognize that heart disease doesn't always look the way we expect it to.
Well, thanks so much for sharing that story. I was tearing up a little bit. So, it's, things you just don't think can happen to you and they do. And then obviously as friends, you don't know all of it. So I appreciate you sharing that full story and just realizing also too, the interconnectedness of our body. You just shared it at the end there about the kidneys and how you were dehydrated and nutrition is so important, one, but then just also how complex our bodies are.
Yeah. So, one of the recommendations, when you have blood pressure, issues is monitor your salt intake, right? So when I was, having heart failure, it was decrease your salt. And and for people listening who might not be RDs or nutrition professionals, like it's not just the salt that you put on your food afterwards. It's like the sodium that's like naturally occurring in things. Um, and so, as a dietitian, like I take that seriously. And so like when my blood pressure is like plummeting, I go to the doctor and they're like, "No, you gotta add more salt back in." Most people don't take that take that recommendation too seriously. Like you're the first person who like actually listened to us.
That's funny.
Um,
Yeah, it's like, okay, like our type A personality is like, okay, I'm gonna do it really, really well. It's like, all right, calm down.
can't do what I'm told.
Yeah. You have to have balance.
Yeah.
Um,
Um, so I think I have like 5 key takeaways from my SCAD journey for listeners. One is trust your body. If something feels wrong, don't ignore it. Advocate for yourself, even if you've been told you're too young or you're too healthy. Um, Two is we need more preventive care, but prevention isn't perfect. So a normal test result doesn't guarantee you're in the clear. Listen to your symptoms, talk about all of your symptoms, everything you're feeling, even if it sounds crazy. Talk about it with your clinician. Uh, don't just listen to the numbers. Recovery is more than physical. So healing your heart also means caring for your mental health. Anxiety, fear, and trauma deserve attention too. Include the family. So SCAD impacts your loved ones as much as it does you as a patient. I mean, it's impacted my friends. uh, I think, my husband had to call all of you and say, like, Andrea's not going to be participating in band for a while. It affected my students. One day I'm teaching, the next day I'm not. So their voices and, especially your family and your loved ones, their voices and their healing are a part of the recovery process. And learn CPR. It saves lives. My survival is proof that knowing what to do in an emergency truly matters. My husband never thought he was going to have to use CPR. He's a teacher in high school. But, when he learned that, in an in-service, he never thought he was going to have to use it. So those are my 5 key. Oh, there's a sixth one. Hold space for hope. Living with reduced heart function or any chronic condition doesn't mean that life is over. It means life looks different. So you may have to take more rest periods, even if you're not used to it. You may have to say no when somebody asks you to do something. I know type A, as dietitians, we're always saying yes more often than we should. Um, Listen to your body. We won't get into it today, but I would love to maybe talk about spoon theory sometime. Uh, it is really just like understanding what your limitations are, and when your spoons run out for the day, just relax. You got to build in that time for relaxation. Cardiac rehab, support groups, ongoing medical care can help people not just survive SCAD, but adapt, heal, and thrive.
I
SCAD,
think,
go
I'm
ahead.
sorry, go ahead. No, go ahead.
Okay, I was going to say SCAD changed my life, but it also reminded me how resilient we are. And with the right care and support and awareness, it's possible not just to survive, but to truly live again.
Yeah, I mean, you're so inspiring, but I wanted to say, like, I agree with you. I mean, I think those takeaways, that bonus takeaway was an awesome way to conclude. And I know you gave us a lot of good resources also for listeners to put in the podcast like description. But I do think you have so much wealth of knowledge. I mean, you just mentioned spoon theory, but I was thinking like we should have you on. I mean, you mentioned about the cancer gene that you had and the hysterectomy that you had, which I appreciate you sharing that. And even your experience with POTS, which is like something that has come up more recently. I think I don't think I've heard it until fairly recently, like maybe a few years ago. I hadn't heard of it much, but more and more, people that I know have been diagnosed with that. So that's interesting. So, I mean, you are probably going to be a recurring guest, Andrea. I hate to break it to you. I hope you're okay with it.
Hey, I made the cut.
Yeah, no, you did great. I mean, this is awesome. And I mean, we really appreciate your time and sharing such a personal story and, from both perspectives to like the clinician and the patient. So this has been very, very wonderful and enjoyable. And I'm sure our listeners will enjoy as well.
All right, everyone. So we're going to get going with our sweet and sour. So Andrea, we're going to have you start. You can go in whichever way you want, whether it's sour or sweet first. You pick. We typically do our sours first and then end on a sweet. You can do whatever you like. So go for it.
Okay, well, I'll be the opposite. So I'll start with my sweet. I'm really sweet on the upcoming season of fall. I love everything fall. I love pumpkin, everything. I love apple picking. I love sharing Halloween with my family. This year we're heading up to Sleepy Hollow.
Nice.
I love like leaves changing color in the cooler weather. So I'm sweet on fall. And I'm really sour about my garden this year. Ugh, my garden just did not produce the fruit that I was hoping for. I had so many flowers. I like, squash blossoms. I even planted like more flowers to bring more bees and pollinators.
Yeah.
And like the flowers like opened and then they like just didn't produce any fruit. I don't know, maybe I have a problem with my soil.
Sorry to hear that. Have you tried mushroom soil?
I've tried a lot of different things.
Okay, well,
I
that's
need to be more consistent with something I try.
Mix it in. I didn't give that away. If my husband's listening, I didn't give that away.
I say Emily
like,
and Joe,
and then like it doesn't work, and then I don't try it again.
Yeah, Emily and Joe have like a jungle in their backyard of a garden, so they're the ones that if you need information, they're the ones to go to. Joe,
but it's also climate. Like we're up in a mountain, so we got we're closer to the sun.
Mountain too.
You are? Okay. Well, then maybe you need. Okay, maybe we need to discuss a little, Andrea.
Okay.
Yeah. That was the other thing I was thinking, Andrea. You could just talk so much on policy stuff too. Like, there's just so much we could talk to you about for hours and hours and hours. I was thinking that too.
A lot of things bring me joy, and I've experienced so many things too. So, I could be a recurring podcast or recurring guest for a long time.
Was it as scary and as nerve-wracking as maybe you thought, or?
No, because I think I reverted back to being a clinician more than anything. So
good. Yeah, I mean, I think the next thing for you is, and you probably already started it. You should write a book.
I have had a lot of people tell me that. I don't know. We'll see. Yeah. Maybe.
Stay tuned.
Don't add more stress.
Yeah, don't add stress. We'll see how many people listen to this episode, and if there's a lot of people, maybe it'll inspire me.
There you go.
Okay. Awesome.
All right, Micki, you want me to go?
Sure, if you want to go.
All right, so I will start with my sour. I feel like I've just been so busy lately, especially on the weekends. I was just at a conference last weekend before, like I just had tons of things going on. So I just feel like I haven't had a weekend to do fall things like decorate. I think this weekend will be that, but I'm still like busy. So I'm just going to have to fit it in where I can. So I've been very busy. And then my sweet is kind of going off Andrea's. So we have one tree out front. We used to have two. We took one down because they're like older and they just you could tell they needed to be taken down. We are replanting, don't worry. But we had to take the really old, like 40-year-old trees down, if not older. And they were going to fall on the house. We don't want that. So the other one we have out front is already turning, and like half of its leaves are on the ground already. And my husband had to blow the leaves yesterday. It was so beautiful. The couple mornings ago, I opened the shade. The sun was shining. It was a beautiful sunrise. And I just took a picture and I was like, this is just a fall morning. And I was like, but it's the only tree in my neighborhood that has turned fall. So I'm enjoying it, but I'm going to enjoy when the rest of them turn at the same time.
It's setting the precedent. It's the trendsetter. It's like setting the
exactly.
fall, the fall tone. I like it.
Yeah. All right, go ahead, Micki, yours.
Oh gosh, well, you guys, I'm in the same boat. I am very much looking forward to fall. I'm very much a Halloween girl and excited for sweaters and all that fun stuff. I'm also, my hair was done yesterday, so that was nice. I finally got my hair done after, I was like, the roots are this long, like and it was just like not doing what I wanted it to. So that was nice. And it felt nice to like get some self-care in because I've been super busy lately and all that fun stuff. So I kind of did my sweet first, which I typically don't do. But my sour will be...
I inspired you again.
You did. I know. I always got to follow your lead. You both are like two of my biggest mentors, so it's crazy. Like, I don't know. Anyway,
well, thank you.
Don't know where I'd be without you two.
We even inspired you to dye your hair the same color as our shirts.
You guys, did you match on purpose? Yeah. I didn't get the memo. No. But I am very much on brand with my lemon earrings and my lemon shirt. You can't really see it, but there's lemons on my shirt. But my sour is, I don't know. I'm very much having a hard time with my sleep schedule. And this has always been like my biggest gripe about myself is I'm very much like a night person and I am not a morning person, but I'm trying to like get myself on a schedule. So I'm even trying like sleep aids, like I'm trying melatonin, but melatonin made me like an insomniac. So I don't know what my, like anything that makes you typically drowsy does not make me drowsy. It makes me hyper. So I need to like figure out, I wish I could just accept it and not fight myself on it, but I can't because the world doesn't work on an afternoon and evening shift. They work on the morning shift. And
I always say I'm a middle of the day person because I'm not a night person either. Like I enjoy being in bed by like 9 o'clock. Sometimes my kids put me to bed. It should be like I should be tucking them in, but like I'm all under the covers and they'll come in and say goodnight. Like, and I'm also cute. Not a morning person either. Like they're on the bus at like 6:30 in the morning, and I'm like, nope. I'll wave to them from the window.
Bye. I love you so much, but just not enough to move.
I should preface for the listeners that like they're in high school and stuff, so it's not like I'm sending my 5-year-old off to kindergarten like
bye. Yeah, oh my gosh, that's so funny. Like,
don't report Andrea, please.
No. She's an amazing mom.
She is.
Well, thanks again, Andrea. This has been wonderful, and we'll definitely have to have you on again because there's just so much more to talk about. But Emily, I'll let you lead us out.
All right, sounds good. So if you're in the mood for a boost of juice, check out freshly squeezed episodes on Sundays of the RD Squeeze. So we will see you next time and hope you have a great evening, afternoon, morning, whenever you're listening to this, and smile a little bit.
Middle of the day person.
Yes.
Bye, everyone.
Bye.
Be sure to follow us on Spotify, YouTube, and Instagram. We will always take topics you want to hear about, so message us for any topics you want to see covered on the RD Squeeze. Don't forget, it's dietitian with a T. We'll see you next time on the RD Squeeze.